Hi, this is John Malanca, your host and advocate for the Sacred Plant. And I want to welcome my friend, colleague, and medical expert, Dr. Daniel Stein from the Neurology of Cannabis out of Sarasota, Florida. Dr. Stein has been featured in our series, but most importantly, as an expert on the Healing Brain Masterclass that we offer here at the Sacred Plant. I'm bringing Dr. Stein back on, one, because we've had a lot of questions about brain and how medical cannabis can help with inflammation. Can it change? Can it help with incorporating new brain cells? And so Dr. Stein has a 25 plus year experience in neurology, but also as an expert in medical cannabis. And so Dr. Stein, before we go any further, let me introduce you first off.
Hi there, John. It's great to hear you and see you and be part of this program.
Thank you for that too. And so, from our masterclass, it was a total success, but we had a lot of feedback of questions that are still popping in. And one of the questions that is coming in quite a bit is about Alzheimer's. And you're hearing more about it in the news. You're hearing more about it online. You're hearing more about it, even our friends and family circle of, does cannabis help for this? I have a relative or my parent is going through this, and it comes up quite a bit. And so we talk about prevention, we talk about wellness, and we talk about overall brain health. And so can you talk about what is Alzheimer's, and is it preventable? But also is it and I never use the word cure, but can medical cannabis help if a patient does have Alzheimer's at any stage?
Well, it's no surprise that people are asking about Alzheimer's because it's so prevalent. It's a disease of aging. It's a neurodegenerative disease that's more common in older individuals, especially over 60. And then as we age, the prevalence goes up, up, up. There's 5 million or so new cases every year. And with the baby boomer generation aging, we expect a spike in the years to come. So it's the most common type of dementia. It's associated with aging, and it's very, very common. Unfortunately, we don't have a cure. We do have some treatments that we use in the conventional medical clinic, but frankly, they don't work that well. And so having cannabis as an alternative to the conventional medical treatment is something really nice that we can offer our patients. And I know that we'll go into more details about how cannabis can help. But for now, as far as definitions go, I'd like everyone to understand that dementia is a progressive loss of cognitive function, usually associated with aging, but sometimes caused by other problems like alcohol or medication or strokes. Alzheimer's type dementia is one type of dementia. There are other types of dementia, Lewy body dementia, for example, or toxic dementias like I mentioned, but Alzheimer's is the most common.
And I'm glad you said that, because it is, a lot of families and patients out there don't realize, and I learned from you from our master class, that Alzheimer's falls under the case of dementia. Because I've had patients say, I've asked them if it's a dementia, and they said, no, it's Alzheimer's. And so after our conversation, I've actually educated some of the families that have called, and it's opened their eyes to this type of ailment, but also types of prevention that you can have, potential prevention that you can have with medical cannabis. And so with the various ways, with the patients that you've seen over the years, are there any thing that you can share or experience where cannabis has made a positive difference?
Oh, it certainly has, and I'm excited to use it going forward. Our cannabis clinic has only been open about 2.5 years, and as you mentioned earlier, I've been practicing neurology for 26 plus years. So my personal experience using cannabis for our patients with Alzheimer's type dementia is still growing, and so we're looking forward to using it going forward and seeing more positive results. Yes, though, we have seen some positive results.
And are there certain cannabinoids or terpenes that you kind of go for to help these patients? And back to the patients, would you recommend this for prevention and wellness? And is it hereditary? This comes up quite a bit too. Is it something that, do you have to be old in the geriatric ages, in your golden ages, to have something as serious as dementia and Parkinson's?
So that was about 10 different questions, John. And
You're good though. That's why I threw those at you. I just splattered them with you.
I'm going to take them one at a time.
Okay.
I think I can handle it. In general, Alzheimer's disease develops in two main groups. In young people who have a genetic risk for it, which is a small portion of the Alzheimer's population, and then in older patients where it's more of a sporadic development. It's not clearly related to genetics, even though we have some evidence that one particular gene called APOE, APOE4, does present a bit of a risk. So the bottom line in dementia incidence when it comes to Alzheimer's is there is some genetic predisposition, especially for early onset Alzheimer's cases. But for people that are aging and develop Alzheimer's sporadically without a family history, we don't know so much about the genetics. What we do know is that there are other risk factors for developing Alzheimer's in otherwise healthy individuals. And that includes, in addition to aging, lack of exercise, poor diet, obesity, diabetes, and vascular disease. We know that in individuals who do better with their diet and exercise, the risk of Alzheimer's dementia is lower. We know that because around the world, we have studied different populations and the incidence of Alzheimer's disease associated with those populations. For example, in those individuals that follow a Mediterranean style diet with low saturated fats, more oils or unsaturated fats, and low amounts of animal-based protein, there's a lower risk of Alzheimer's type dementia. Those types of food products trigger what we believe is inflammation in the brain that then leads to amyloid deposits. Now, these amyloid deposits are what we believe are the main problem that causes neuronal dysfunction. When Alois Alzheimer discovered Alzheimer's disease, he was looking in the microscope at the neurons in the brains of these individuals that had passed away with Alzheimer's. And he discovered that these protein deposits, which turned out to be amyloid proteins, were collecting between the neurons and just causing a problem with the anatomy. There's another type of anatomical process called tau, T-A-U, which is another type of protein. Phosphorylated tau and the amyloid proteins together are the microscopic problems that we see in the brains of Alzheimer's patients. So our understanding of this particular condition is based on that neuroanatomy or pathology.
So Dr. Stein, regarding Alzheimer's, and I know you mentioned about benefits of cannabis, are there certain cannabinoids or terpenes that you stick with or stick out more when treating a patient?
When it comes to treating patients with Alzheimer's, we have to be careful with THC. You know, THC is the psychoactive ingredient in cannabis, and it can potentially cause problems with patients who already have cognitive dysfunction. So we try not to use too much THC. CBD with small amounts of THC, however, can be very effective for Alzheimer's patients who have, for example, pain and agitation, insomnia, restlessness, trouble with appetite. So we use a combination of the main cannabinoids, CBD and THC, in a careful measure to try to reduce those symptoms so that these patients are living a more functional, happier life.
And with these cannabinoids, and you mentioned low doses of THC, and I'm glad you mentioned that because a lot of patients are afraid of THC, and I think because of the media sharing all the information about CBD, and CBD. That's all we hear out there. And so a lot of patients come to us, and I'm certain they come to your office saying, I want the medical part of the cannabis plant. I don't want to be high, and give me CBD. And so I'm glad you mentioned, can you talk about the entourage effect before we go on?
Sure. You know, the entourage effect initially described by Professor Mishulam has to do with the combination of different cannabinoids and terpenes, for that matter, as well as other molecules, that creates an effect that's much greater than the sum of its parts. And the classic analogy is the orchestra that sounds so much better with all the instruments together compared with just a single solo artist. And so that's what we find in cannabis therapy. The molecules together work better than each individually.
I love that description, and I'm going to use it. And you have my word. I will quote you every time I mention that, because the way I always talk about it, and Crin's description was, it's like baking a cake, you know, and leaving out the flour, or leaving out the egg, or leaving out the water. And so, but I will add your orchestra. What a great visual.
Well, you know, I actually can't take full credit. I heard Ethan Russo use that analogy in one of his presentations.
Okay, well, I'll give you subtitles on that. However, I'll put the footer header. I'll give you some credit though. I heard it from Dr. Stein, who heard it from Dr. Russo. So, but thank you for that. You know, because that does, like I said, that does come up quite a bit. Are there any other terpenes or cannabinoids that you would recommend? I know we've talked about THCV, which really isn't accessible right now. What about you know, for inflammation, there's a lot of studies showing THCA as well as CBDA, the raw form, the acid form, non-psychoactive, is also great for inflammation. Would you incorporate that, or do you incorporate that with any of your patients?
I do. I incorporate the minor cannabinoids and the terpenes depending on what our treatment goal is, because when it comes to treating symptoms, it's important to have, I believe, directed therapy. So for example, if someone is having pain, we need some THC along with the CBD. That's important as an analgesic. If someone is having anxiety and restlessness, we have to really be careful with the THC and use more CBD in those situations. As far as terpenes go, pinene, it turns out, has this special effect on an enzyme in the brain called acetylcholinesterase. That particular enzyme breaks down acetylcholine, which is already in short supply in patients with dementia. Acetylcholine is that neurotransmitter that's important for cognitive function. It's low in Alzheimer's disease. And if we can limit the breakdown of acetylcholine by using something like pinene, it has an enhancing effect, at least theoretically, on neural transmission. So I like pinene in patients with Alzheimer's type disease. THC actually also inhibits acetylcholinesterase. And so we're trying to promote the good neurotransmitters, limit the side effects, and come up with a specific treatment plan depending on what symptoms the patient has.
I thank you for that. You know, you mentioned that it's you know, we're talking about the aging brain, and as this is normal, because I think you mentioned there are 5 million cases a year, and will be growing with the baby boomers. And so you're talking about this as it's just a normal way of life. And so what about the other types of decline in the brain that's like memory loss, brain fog, cognitive delays that reduce to the reduction of daily activities? And so when you see that this is present where it wasn't before, what are you looking for? What do you share with your patients when they come into your office?
When patients come into the office complaining of trouble with cognitive function, it's very important to take a careful history. That's what we call it, the physical exam and the history of what's been going on with that individual. We try to talk to family members. And of course, we look at the medical record to put together the puzzle, because it doesn't have to be Alzheimer's disease. You know, older patients that have cognitive impairment might have a problem with sleep, for example. Let's say they have sleep apnea, or they're not getting enough rest for some other reason, they may not be on their game the next day, not functioning normally. And the solution to that would not necessarily be cannabis, but rather lifestyle adjustments so that they sleep better. We have to do a sort of an investigation of what the cause of cognitive impairment is. And it can be any number of things.
So it's almost like a domino effect with lack of sleep. Sometimes lack of sleep brings on pain, fogginess. You know, the last couple of nights I haven't slept well, and I've been sleeping like a log lately and dreaming, and I'm loving it. But the last 2 nights I haven't, and so you know, I might incorporate, you know, a cannabinoid tincture to help me sleep, because, you know, the last couple of days, even with at my young age of 52, you know, I still have a little brain fog throughout the day. So we talked about different plaques, and, you know, how does THC and CBD help with amyloid plaques and the tau? Is that the correct pronunciation? The tau, TAU?
So yes, the amyloid plaques and the phosphorylated tau are the molecular bad guys that develop in the brain and cause a loss of nerve function, leading to cognitive impairment. If we could get rid of the amyloid plaques and the tau deposits, we believe that the condition would be cured, basically. But unfortunately, those abnormal proteins continue to develop in older individuals, and in patients with Alzheimer's, it becomes pathologic. The way that it becomes pathologic, the way that we use cannabis to help reduce the disease is theoretic at this point. In the laboratory, we know that THC, CBD, THCA, and CBDA all have a neuroprotective effect. And in laboratory models, not in humans, but in laboratory models, we see that those cannabinoids, the neutral and acid forms, can reduce amyloid deposits and to some degree also development of tau.
And I'm glad you talked about neuroprotectant, because cannabis is a neuroprotectant. And it's unfortunate because cannabis currently right now is only legally available in 33 states and the District of Columbia. But it's still scheduled as a Schedule 1 regarding a neuroprotectant, and that's frustrating. So hopefully that law will change, that everybody will have access to that. And so right now there's a lot of claims about cannabis as a neuroprotectant, but also benefiting Alzheimer's. There have also been claims relating to neurogenesis as well. And how does cannabis impact this process?
Well, in addition to acting as a neuroprotectant, we have some evidence that cannabinoids, CBD and THC, can promote neurogenesis. And we have, again, this is laboratory evidence, not in humans, but in the laboratory. We see evidence that tiny new nerve cells are generated in the hippocampus, which is the part of the brain that shrinks down in Alzheimer's disease. Those nerve cells that are new and growing and promoted by the presence of cannabis can help replace some of the lost neurons in that part of the brain that's so important for memory function.
Can we regenerate brain cells?
Yes, we can regenerate brain cells.
With cannabis, so?
Yes, there is evidence that neuroregeneration is enhanced in the laboratory using cannabis. So this is super exciting stuff because, you know, when I was going to medical school, you know, I graduated back in '87. We were still learning about the ability of the brain to regenerate itself. And we used to think that the neurons that you were born with were all the neurons you were going to get. And if you fried them with using drugs, that's it. They're gone. This is your brain on drugs type of thing. So that's all false. All right. So we now know that there is regenerative capacity in the central nervous system, and that using cannabinoids in the laboratory with the models that we have we can see some of that enhanced regeneration.
Great. And I think a lot of our followers will be happy to hear that you can regenerate brain cells, with cannabis too. So we also learned in the brain master class that cannabis currently is being used to help relieve symptoms or slow the progression of Alzheimer's versus treating to heal the condition. And can you touch on that? Because I know a lot of our followers have been asking, can I use this for wellness? Can I use this for prevention? Unfortunately, in a lot of states, for prevention and wellness is not a qualified condition. I just think that's totally a disservice. And so, can you talk about using cannabis as a prevention?
We use cannabis as treatment for symptoms in Alzheimer's disease. So that would be termed palliative or symptomatic therapy, as opposed to disease modifying therapy, which is what the neuroprotective angle is all about. And certainly a well-designed wellness approach would include all these different things: neuroprotection and wellness, preventing diseases before they develop, and then, of course, treating them the best you can when they do develop. And symptomatic control for Alzheimer's patients is very important. And we do have some tools in the toolbox, the cannabinoid toolbox, to help with a variety of Alzheimer's related symptoms.
Can you talk about that? Because that comes up quite a bit about symptom release. And, aside from reduction of anxiety and stimulating normal eating habits, what other benefits have you heard or seen through research that's coming up for those of you who are struggling currently with Alzheimer's or, getting older?
I think one of the less appreciated but very important symptomatic therapies for Alzheimer's, as far as cannabis goes, is the ability to reduce other pharmaceutical agents. So, for example, an Alzheimer's patient who's using narcotics or other types of pain therapy will be able to replace those medications with cannabis, enjoy pain relief, and not have the side effects of those pharmaceuticals. Same thing with anxiety, sleep disruption, agitation, and restlessness. A lot of patients with Alzheimer's type dementia are on sedative agents in addition to opioid or other analgesics. We can replace both of those classes of medications with cannabis. And we know that patients with Alzheimer's who have hallucinations and delusions or other types of psychotic symptoms are on very strong medications we call neuroleptics. And those sedatives of the neuroleptic class are actually associated with increased mortality in patients with Alzheimer's. And so by reducing those pharmaceuticals for all those different symptoms with a plant medicine that has very little, if any, side effects when used properly, we can enhance not only the symptoms going on day to day, but maybe even prolong life and improve the quality of life.
Can you talk about the prolonged evidence that you've seen that medication? And again, I'm not against conventional medicine at all, but a lot of families and patients that we talk to, the same thing. They'll say, let me try this first, meaning a conventional pharmaceutical route. And if that does not work, I'd like, maybe we'll go to the cannabis route. And so can you talk about, can you use them side by side? Can you talk about why medical experts needed even to titrate off any type of medication, but most importantly, Alzheimer's medications, while using cannabis? And then I know I'm throwing a few questions out to you, but just the drug-to-drug interactions as well to be careful for or look out for.
When it comes to using medications like neuroleptic therapy, common names would include Haldol or Seroquel or Risperdal. These neuroleptic therapies are very strong medicine, and it's sometimes necessary to use those medicines when patients are in danger of hurting themselves or others. But if you use those types of therapies for more than a few days or a few weeks, we know that there's an associated mortality risk. 25% or 30% of patients using those therapies may pass away within the next year, compared to maybe 5 or 7% of patients not using those medications. And in the pharmaceutical literature, there's what we call a black box warning, indicating the severe risk when using those particular pharmaceuticals. When we have cannabis as a useful alternative, and I have talked personally with numerous doctors about this, it's a welcome alternative. We get rid of the neuroleptics, we use cannabis in a safe and measured way, and those patients are able to reduce risk of harming themselves and other people, and prolong their life.
You know, with that, because I'm certain you have a lot of cannabis naive and beginners that come into your office that think the only way to consume medical cannabis is from back in what they've learned in the 50s or 60s, 70s, 80s, and present, that smoking is the only way to do that. And what would you recommend with some of your patients? And can you share any success stories you've had with families that have come into your office, even a small win with cannabis and treating Alzheimer's?
Our success rate treating symptoms in patients with Alzheimer's type dementia is approximately 90%. We can almost always provide some relief. We've had only occasional patients come in with their family members saying, well, this just didn't work for us. And I think 10% failure rate is something that other cannabis experts have experienced in their clinics. So of those 90%, we have to use sometimes creative ways to get the medication into the patient. Obviously, patients with dementia are not going to be reliable taking their own medications, so they need caregivers to help them oftentimes. And smoking, as you said, is not the preferred route of administration for the vast majority of these patients. Fortunately, other administration methods, for example, tinctures, are very, very effective and easy to dose properly. So I like starting out most patients with tinctures because it's easy to use. We can dose them carefully, and the effect is beneficial in most cases if they're willing to stay on the therapy, titrating up the dose. It usually takes about 3 or 4 weeks, sometimes longer, to get to that benefit.
And are you? I know you're in Florida, and sometimes you're limited on what type of methods you're able to recommend to your patients. But are patches available there, and or have you seen any studies with the patches for the dementia patients, Alzheimer's patients that, like you said, need a caregiver to keep them on track?
In addition to tinctures, we do have patches. We have transdermal gels that do get into the bloodstream and have systemic effect. And recently, we now have powder that's soluble in water. So we can actually dose patients using a little THC and CBD powder, which they'll get dissolved in their food or beverage, and they drink it right down, again, in a carefully measured way.
And so, Dr. Stein, before we close out here, you mentioned about symptom relief as well as memory. And so roughly, what can a patient or family member see improvement with symptom relief versus memory? Is it weeks? Is it months? Can you talk about that?
When it comes to symptom relief having to do with sleep or pain or anxiety, we can usually achieve a good result within 4 to 6 weeks. The more difficult symptoms of Alzheimer's having to do with memory loss, language dysfunction, spatial disorientation, things like that, it takes longer to expect some benefit. And our success rate is not quite as high with those other, more difficult problems like memory and language function. But I would not give up on treatment for maybe 3 or 4 months, sometimes longer. John, the pharmaceutical drugs that are available, like Aricept, also called donepezil, did not show evidence of improvement for 1 year. And when it came time for the FDA to approve those agents, it was only because there was some small change noted after a year on therapy. So that's the time course we're talking about.
Well, hopefully the FDA will get involved one of these days and see that there is a shorter, I guess, success rate or improvement, I should say, in regards to symptom control. So, Dr. Stein, is this something that a patient has to use every single day, or you recommend using it? Do they do it in the morning, noon, night? Do they do it before bed? What would you recommend?
When it comes to disease modifying therapy, you want to treat every day because you want to encourage new neuronal growth. You want to reduce the accumulation of amyloid and tau. And for those types of therapies, you need to medicate on a regular basis every day. When it comes to symptomatic therapy, you can be a little bit more liberal and use the therapy as needed.
And I'm a broken record with this. Always include a medical expert when incorporating medical cannabis, especially if you're on other medications. If you're going to use Dr. Stein or someone else, have this conversation with your doctor, your current doctor, if medical cannabis is right for you, or if he or she is knowledgeable on this. And if they're not, see if they can give you a recommendation. My recommendation, of course, is Dr. Stein. You can find him at the Neurology of Cannabis in Sarasota, Florida. And so, Dr. Stein, I so appreciate you sharing your insights and clarification into this and what can seem like a daunting topic for a lot of families and a lot of patients. For our listeners and beyond, what do you recommend to ensure you're keeping your brain working optimally and keeping it going?
The different pillars of wellness having to do with diet and exercise. Cognitive function is super important. So it's one of those things where if you don't use it, you're going to lose it. We encourage all of our patients to remain active cognitively, go to social events, have leisure activities, and the combination of those things should help a whole lot.
Even picking up a hobby, and you're never too late to pick up a hobby. If it's taking a walk, if it's crocheting, if it's picking up an instrument, playing piano or guitar, is great for the aging brain, even the younger brains. And so I know we did talk about the pillars of health, and so thank you for reminding me about that. Dr. Stein, I want to thank you again for being available for myself, the Sacred Plant community, and patients, potential patients that are coming your way too. So Dr. Stein with Neurology of Cannabis in Sarasota, Florida. Thank you. And to everybody out there, wishing you a healthy brain and a healthy life. We'll see you soon. This is John Malanka with the Sacred Plant signing off. Bye-bye.